Hello, good afternoon. So we're good to go? Okay, thank you. Good afternoon, ladies and gentlemen. Welcome to this joint WHO, UNICEF, Lancet Countdown press conference on climate and health. I am Dr. Hande Harmancı, the representative and head of office of World Health Organization in Azerbaijan, and I will be moderating this press conference today. Let me introduce our speakers. I have Dr. Maria Neira. Maria is the director of WHO's Department of Environment, Climate Change and Health at World Health Organization. Mr. Abid Solomon is a senior advisor on environment at UNICEF. And Maria Wollavander is a climate change and health research fellow for the Lancet Countdown collaboration. Yesterday, on 11th November, the 29th UN Climate Conference opened in Baku, and we are here to promote the health argument for a bold, ambitious, and urgent climate action for health and well-being of all. In the words of my Director General, Dr. Tedros Adhanom Ghebreyesus, the climate crisis is a health crisis. Prioritizing health and well-being is not only a moral and legal imperative, but a strategic opportunity for a more just and equitable future. You will hear more about this from our speakers shortly. You should have already received a media advisory with additional information about the subject. If you haven't, we have staff in the room that we can distribute further. And the key health initiatives at COP29 and the REACH program at this year's Health Pavilion. And finally, on the subject of this press conference, COP29 represents a significant milestone in the global efforts to integrate health and climate action and to build on commitments made at previous COPs. We will therefore focus the discussion today on climate and health and the expectations from this conference in terms of advancing the agenda to protect health in the face of climate change. So with that, let me give you the floor. Dr. Maria Neira, over to you.
Thank you very much. Good morning to all of you. Good afternoon. And thank you very much for attending this press conference. As my colleague, the WHO representative here in the country has announced, WHO is here. WHO, intending by WHO, the global health community is here to make sure that all the negotiators that are inside trying to define the level of emissions that we need to reduce or the actions that needs to be taken in order to address the problem of climate change, we want them to be aware that when they are negotiating emissions, they should know that they are negotiating with our health as well. So that's why we are presenting in advance of the COP and making sure that everybody understands the importance of health. We have launched this report, which is called Health is the Argument for Climate Action. And the reason why we say is the argument is the following. First, climate change is making us sick. As simple as that, in the words of a medical doctor. Climate change is making us sick. Making us sick because it's affecting the way we are producing our food, how polluted the water we drink is, how polluted the ocean with plastic is, how polluted the air we breathe is, and how we will be forcing our population to be displaced, how the extreme weather events are affecting our population, how the heat waves are now killing people around the world, and of course how it's affecting the mental health of our people. So it's making us sick. I think this diagnosis is clearly based on science, no controversy, and unfortunately we see the urgency of this climate change impact on our health every day across the globe in different events. The second part of that is maybe the most positive one, is that if we use the health argument, if we make sure that everybody understands that by tackling the causes of climate change, the health benefits that we will unlock from those interventions can be enormous, can be very positive for our health. For instance, we will make the quality of the air we breathe much better, and we can reduce, therefore, the 7 million premature deaths that are occurring every year due to exposure to air pollution. We can create a better more sustainable food systems, and therefore reducing the mortality, reducing even 5 million deaths due to lack of access to healthy diets. And by the interventions we make at the urban space, at the urban level, where 70% of our population will be living in 20 years from now, by promoting a sustainable transport system, we will reduce sedentary lifestyle, we will reduce all the diseases associated with this lack of active life, and of course, exposure to air pollution, lack of energy efficiency. So we can gain a lot from the interventions to mitigate the causes of climate change, and therefore, I will leave you with a final message. If we look only at 5 interventions that we put it on place, like reducing or stopping completely giving subsidies to fossil fuels, if we look at interventions at the urban space, if we look at early warning systems for heat waves, we can already save every year 2 million lives. And I think this is the argument, the health argument is the one that can motivate our negotiations to understand that the level of ambition on these COPs and the speed at which the decisions are taken, they need to be accelerated if we want to protect people's health and if we want to obtain more health benefits. The investments are not the argument. The health is the argument. Thank you very much.
Thank you so much, Maria. Climate is making us sick. Using the health argument pays off. 5 interventions save 2 million lives a year. So with that, I move on to Abid Salamon, UNICEF.
Thank you, moderator. And good afternoon to everybody. I think how we say it in UNICEF, climate change is not just changing the planet, it is changing children, and nowhere it's more visible than the health and well-being of children. It is impacting almost every aspect of child health and well-being from pregnancy to adolescence. So there's this leaflet that my colleague Emma can share with you all. It highlights the summary of our recent report called A Threat to Progress. And essentially, this report talks about some of the biggest risks to children's health coming from extreme heat, from droughts, from floods and storms, from wildfires, from air pollution, and for changes in the ecosystem. These climate-related hazards are linked to pregnancy complications, adverse birth outcomes, child malnutrition, killer infectious diseases like malaria, non-communicable diseases like asthma, impact on neurodevelopment, and mental health, including developmental delays, cognitive dysfunction, and depression, injuries and effects on well-being, including learning loss, including violence, abuse, and exploitation. And I went through a litany of this because it was important to emphasize that we are seeing the impacts on children's health based on the studies that are already there in almost every aspect of child health and well-being. So the question you might ask is, why is climate change disproportionately impacting children? And if you actually look at children's physiology, their behavioral patterns, and their dependence on caregivers, it makes them uniquely vulnerable. So let's go a step deeper. Let's talk about pregnancy and the developing fetus. Under conditions of extreme heat, a mother's body struggles to maintain a healthy temperature for the developing fetus. Therefore, excess heat is linked to babies being born prematurely and being born small and with birth defects. There's one study in the report that talks about the odds of stillbirth and preterm birth increase by 5% for every 1 degree increase in temperature. In childhood, a child eats and drinks and breathes more compared to their size as compared to an adult. If you see any, and everyone has children in their lives one way or the other, so if you think about an infant, a child by the time is becoming 1 year old has tripled their body weight. So think about that as their bodies demand far more nutrients per kilo than adults, they become acutely vulnerable when nutritious food is scarce. And that's a challenge, as we know what droughts does in terms of malnutrition. And malnutrition is not just about what it does to slow the growth, it stunts their potential, that is, means their cognitive development, it weakens their immune systems, and makes them more vulnerable to infectious diseases. Food insecurity, water contamination, and the spread of infectious diseases resulting from floods, droughts, and changing patterns of disease are threats to children's ability to survive and thrive. All of this has been laid down very well in the report, and you will see also that even in adolescence, children are vulnerable because their brains are still navigating the complex emotional and cognitive growth and developing skills that govern decision-making and impulse control. So when we look at what happens to children, we're looking at impacts in terms of climate-related trauma and instability, which may have a lifelong impact. So what does this mean for climate action? Well, what the report talks about is that the purpose of climate action is to protect humanity's future, its children. And therefore, we are failing children if we do not keep the 1.5 degree promise. The report talks about not just the what of keeping the 1.5 degree promise, but also the how. How, as Maria talked about, also we could reduce air pollution as we reduce emissions, because that will have huge benefits for children. If we do not prioritize essential life-saving services to protect children, we are failing children. This means we need to equip caregivers, we need to strengthen primary health care, we need to safeguard nutritious food, safe water, and social protection, and improve preparedness and response for extreme weather events and disease outbreaks. And we should remember that climate change is one of the 3 planetary crises. Pervasive pollution and the loss of biodiversity are also devastating children. So, for example, almost half the children that we have been testing over the last couple of years, we find them to be poisoned by lead. So we need comprehensive approaches like One Health that address all health threats at once. And in support of this, UNICEF, the WHO, UNEP, and the World Bank are working to drive solutions towards children's environmental health. But all said, the reality is only 2.4% of the key global climate funds incorporate child-responsive activities currently, but children make up 30% of the world's population and 100% of its future. So right now, here at COP, the success of the summit will depend on key actions by leaders. Firstly, we must see a dramatic increase in climate financing for children. Secondly, a guarantee that all climate plans, including nationally determined contributions 3.0 and national adaptation plans, are child sensitive. And thirdly, a cover decision that includes an explicit commitment to the response on the unique and disproportionate impact of climate change on children. And it all starts with children's health and well-being. We need to fix this. We must prioritize child health and well-being in climate policy, investment, and action. Future generations will hold us accountable for the climate action we take today. Thank you.
Thank you very much, Abhi. So you mentioned that climate change affects children disproportionately. Health and well-being, every aspect is important. And if you want to protect humanity's future, it's the children, and there should be more funding in children's environmental health. Now I'm going to give the floor to Maria Wallavander from the Lancet Countdown. Lancet is doing a great job in monitoring how everything is going. You are giving us the numbers to keep us accountable. So what's happening there, Maria?
Thank you, Hande. Hello, everyone. It's a real pleasure to be here today, and a particular privilege for me to be on stage with such esteemed colleagues. As Hande mentioned, I'm part of the Lancet Countdown on Health and Climate Change. It's a global collaboration of over 300 doctors, scientists, engineers, and a variety of other experts who track the evolving connections between climate change and human health. On October 30th, we released our most recent report. There are links in the media pack, and I also have a QR code if anyone's interested afterwards. This marked our 8th publication, and it revealed some of the most concerning findings to date. The title of our report summarizes it well. We are currently facing the human costs of delayed climate action. Our report tracks 56 different metrics. 15 of these focus on climate change-related health hazards, exposures, and impacts. Of these 15, 10 showed record-breaking highs in their most recent year of data. This includes all-time high exposure to heat wave, tens of millions of people newly experiencing food insecurity due to heat and droughts, and increasing suitability for the spread of dangerous infectious diseases like dengue. Despite many years of the Lancet Countdown, the WHO, UNICEF, and many others raising the alarm, we see that countries and companies continue to fuel the fire of climate change through persistent reliance on and continued investment in fossil fuels, and through delays in adapting our communities to be ready for the growing climate hazards. We have long known that it's essential to drive down our greenhouse gas emissions in order to curb global heating and to ensure a healthy future. Yet we saw record high carbon dioxide emissions from the energy sector in 2023. Meanwhile, uptake of renewable energies is progressing, but only slowly, with large inequities in technology access and use between richer and poorer countries. Our most recent report not only highlights these realities of the crisis that we're in, it also reminds us that we have everything we need to address this crisis. We know the solutions that work, and we know how to ensure that climate solutions and climate action also brings health benefits. We've already seen how coal phase-out activities can directly lead to a decrease in deaths due to coal-related air pollution. We also know that the world has the finance that we need. Our report calculated $1.4 trillion in net fossil fuel subsidies from just over 80 countries in 2022 alone. This is money that could be redirected away from harmful fossil fuels and towards healthy, just, and equitable solutions. COP29 needs to be a pivotal moment. We don't have time to waste. All of us on this stage present a unified message that the climate crisis is a health crisis. And the evidence underscores that it's already harming children and people of all ages in every country. We need to see people and their health and well-being put at the center of climate conversations. And we need the world to take the bold, decisive, urgent action that's needed to protect human health today and for years to come. Thank you.
Thank you very much, Maria. We are proud to say that WHO is, and Lancet Countdown is a very strong collaborator, the two of them. And Maria just told us that they have their 8th report out, shows we are not doing well, but we can do better, all in data and evidence, right? Okay, now this concludes our statements, and now it's time for your questions and answers. We will have 2 microphones. I think traveling microphones, right? We have. So please raise your hand, introduce yourself if you want to ask a question. We need a microphone up front, please. Thank you.
Thank you, moderator. And thank you everyone who make presentations. Satoru Mizuguchi, freelance. I have a question to Dr. Maria. You mentioned climate change is making us sick. I agree that the climate change impact healthcare system. But the healthcare system itself also polluting the earth by consuming much energy and the plastics. So my question is, as a WHO, how would you encourage healthcare sector to impact less to the earth for the mitigation as well as the smart use of plastics? Okay. Thanks.
Go ahead, yeah.
Thank you. Thank you very much for that question because it allows me to focus on this, which is extremely important. Yes, the health system contributes to around 5% of the global emissions, the global carbon footprint. Not all the health systems, of course, those of the medium and high-income countries. Other countries are not contributing and they don't have access to electricity or to energy. So two things that WHO is putting in place. One is this alliance, this platform called ATTACH, Alliance for Transformative Action on Climate Change and Health, where we have now 90 countries joining. This was launched in COP26 under the leadership of UK, who was hosting the COP that year, and is to promote low-carbon, climate-resilient health system. And we are very pleased to report that this alliance is generating a lot of positive motivation because the health professionals are very happy to assess their contribution and start to put in place measures to reduce the consumption of plastics or making sure that they will look at their supplies chain and reduce it. They look at the patient care and how we can reduce as well in the commuting at the hospitals and food serve. And the third one is about digital medicine. So very different options, and all of those options are shared at the platform of ATTACH, where all the countries are sharing best practices and moving on a very strong way. But this is one part of the piece. The other one is the fact that many countries are not contributing to, and the health system is not contributing, but we still need to make sure that they gain access to clean sources of energy. And that's why WHO, in collaboration with UNICEF, with Gavi, with many others, we are having this project on solarizing the health system. We are putting solar panels in our healthcare facilities to make sure that they are gaining access to clean sources, non-climate contributing sources of energy, and accelerating this transition to an energy that is not killing us as the combustion of fossil fuels. So on a very short summary, but I hope this satisfies.
Thank you, Maria. Yes, this young lady here, and then we will go to you, sir.
Hello, just to introduce myself, my name is Maya. I know that there was some discussion about intersectionality, particularly in reference to the intersection between children and their disproportionate impacts. But just also noting that non-metropolitan areas experience both unique health access challenges and frontline climate impacts. I was just curious as to what is being recommended to support the health of rural and remote communities as the effects of climate change continue to worsen.
Could you repeat where you're from?
Oh, I am from Australia.
No, are you a journalist?
No, I am a
okay.
youth activist.
Okay.
Sorry, would you mind repeating that? Yeah, of course. So just wondering what is being recommended to support the health of rural and remote communities as the effects of climate change continue to worsen due to the intersectional issues faced by them.
I knew, yeah. So we'll take those two questions together.
Thank you. This is a question for Dr. Maria. I'm Bimal Khatka, representing IPPNW, International Federation for Prevention of Nuclear War. Recently, United Nations has adopted to study the impacts of nuclear weapons on the environment and health system. We have an old report of 1987 of WHO, and now we are working on to update the study. As we're having an impact and a very potential study now working on the climate change, how do you think the WHO and the Lancet and others can come together and make an impactful study so that the people could know at the moment? And we do believe that in 21st century, the climate change and the nuclear war are the two most existential threats for mankind. Thank you.
Thank you. Unfortunately, we have only like 6 minutes left, so let's gather a few, if you don't mind. Yes, for lady in the back, and then a gentleman here.
Thanks.
And then we'll try to respond as much as possible. I see another hand in the back also. And so this lady, this gentleman, and then the other lady in the back, and let's do that.
Okay. This is for the WHO. I'm Jana Marks. I'm from South Africa. We are a developing country, and because of climate change, we are facing severe outbreaks of malaria, cholera, and the impact of heat waves, of course. The WHO has provided extensive support to South Africa and the broader African continent. If newly elected President Donald Trump decides to repeat history, such as pulling out of the WHO, stopping or halting financing, how would that impact the WHO's health initiative and efforts in South Africa and also in Africa?
Thank you. Could you pass the microphone to the gentleman? Thank you.
Yeah, hi. I'm Chetan Bhattacharjee from Health Policy Watch. The current funding from funds like the GCF that are going towards healthcare, they're not being used for renewables, they're not being used for decarbonization. I was informed about a project in Malawi. Sorry, I'll repeat that. The current funding from funds like the GCF that are going towards healthcare is not being used for renewables, for decarbonization. And I was informed about a project in Malawi. So how can we ensure that the finance for climate is being used for the decarbonization in the health sector?
We need one more in the back. There was a, yes, lady. Please, let's have that question, and then we will have to wrap up. And then, okay, we'll get yours too, and then we'll wrap up. Thank you.
Thank you. My name is Lillian. I'm from Kenya. So my question is, with the decreasing donor space, it's for all of you, with the decreasing donor space, which we are experiencing right now, my question is, because I know that all UN agencies, they work with the governments of within the nations that you are in. So my question is, how are you working with the governments to contribute to a net zero? Because with the increasing donor space, that is the way to go in combating the effects of climate change. Thank you.
Thank you. And the last question, please.
I am Borhanul Ashikin, senior journalist from Bangladesh. Bangladesh is one of the most vulnerable country for climate change, and we are situated in the coastal area. In coastal areas, salary institution already is happening, and for this reason, women of the coastal area, they are suffering most. So on these grounds, what will be your argument or what will be your recommendation to the global north so that to control the carbon emission? Thank you.
Thank you very much. So let me start with Abid, and then we'll go to Maria, and then Maria to wrap up. Answer the questions, if you can, please,
yes, sure.
In your closing statements. Thank you.
Well, let's start with the last one. The recommendation is to stick to the 1.5-degree promise that we've agreed to as nations, and that is the number one thing that needs to happen in the context of Bangladesh. And I'm coming to your question also, because how we see it in UNICEF is that the most vulnerable are the ones that are the most disadvantaged already. So climate change is going to make inequities worse. And coming back to the areas in rural communities, I think it's really, really important to strengthen primary health care. That has to be the focus. It has to include the focus on strengthening the role of caregivers, because they are, frankly, the first line of defense as it concerns children. And of course, the role of the health services that are absolutely, absolutely critical. But it's not just what we do at community level and how we support in the healthcare sector. It is a lot to do with food, water, social protection. Those are essentials. We cannot achieve good health and ensure resilient communities and children without that. That's it. Pass it to Maria.
Thank you. Let me start with the lady from Australia, the doctor from Australia. What we do to promote interventions at the rural level for doctors and for health system. WHO has developed, when I mention WHO, is with the global health community as well. We have developed an operational framework recommending what are the interventions to make our health systems more resilient, and at the same time, how to assess the possible impact, which type of epidemiological surveillance system for climate climate-sensitive diseases, which type of training for the health workers, and making sure that all of those interventions are coherent, and they will allow us to respond to dengue, to respond to malaria, to respond to refugees increase, depending on the crisis. I said refugees because I see the head of the UNHCR there, so I got inspired by that. And so this operational framework I will strongly recommend. Regarding the finance for climate change, I'm sure you know that it's not a secret that at the moment there has been principles that have been decided with WHO and other partners and foundations looking at how to finance climate change and health, but unfortunately we still have less than 1% of the global funds on the environment of climate and mitigation and adaptation. Only less than 1% of those funds are going to health. So we need to make sure that we channel the funds, but at the same time we do some divestment of the funds that we are putting now on fossil fuels, obviously using the subsidies we are giving now to the fossil fuels, the governments are giving to the fossil fuels, they can move to others. So it's not just the new funds, but use on a very strategic, coherent and way the funds that are mobilized. Yes, I have to finish.
Yeah, we have to finish. I'm sorry, I'll give 30 seconds to Maria, because probably there's another one after us, so go ahead.
Maybe on the nuclear, because I see the gentleman there. On the nuclear, WHO is dealing with that, and of course, WHO will be always very much concerned about the use of nuclear weapons, and the impact on the health of our people will be absolutely devastating. So I think that's very, very clear.
I'll be very brief, and I'll just make 2 quick points that hopefully hit on a couple of questions. The first is I'll emphasize what Maria has said and what I said earlier. We have the money we need in the global finance system. It's just about where we're putting it and what we're prioritizing. So I think if we can really drive health to be at the center of our climate conversations, not just health conversations or climate and health conversations, but all climate decision making, that's a real great way to ensure that money is going where it needs to protect health. And finally, I would just say, there's 3 of us here on this stage representing different organizations, 4 of us, 3 organizations, and there's a whole host of people working in the climate and health space, and we all have a part to play, whether it's levering on our governments, working in our local communities, and there are so many ways that we can see the action we need, even if we might experience roadblocks in different moments in time. So thank you.
Thank you so much, ladies and gentlemen. It was a pleasure hosting you and moderating this session. Have a good afternoon.